The health sector is supposed to have a sector strategy for the 3 years of the MTEF, which will be the basis of budgeting and program implementation for the 3 years. And this MTSS is supposed to be based on empirical evidence of projects and programs in the sector in the last 2-3 years, the results they have achieved, lessons learned, and experiences drawn, and from there, you now begin to project for the future. And also based on high-level national and international policies and standards. And as we can identify in the health sector, we have the National Health Act 2014, we have the National Health Policy of 2016, we have the health components of Vision 2020, and the recently unveiled Economic Recovery and Growth Plan 2017 to 2020. We've also various standards from international level. We have the Sustainable Development Goals. We have various treaty obligations, for instance, the Covenant on Economic, Social, and Cultural Rights. We also have commitments under the Convention on the Elimination of All Forms of Discrimination Against Women. We also have commitments under Chapter 2 of our Constitution, which is the fundamental objectives and directive principles of state policy. And so, we have a plethora of laws and policies which should guide the implementation of the right to health. Of course, we have the Child Rights Act, which talks about the right of the child, and all other issues around maternal, newborn, and child health. Now, if we move from there specifically, we can begin to see that the challenge for Nigeria is not about laws and policies. There are a good number of them. And it's not even about cliches and saying health for all, universal health care, and all those kind of cliches. It's about implementing the basic state obligations which we have already accepted as part of Nigerian laws and policies. If you go to section 2, under page 5, you look at key challenges of the health sector. And we sought out to lay out goals, objectives, and targets based on high-level national and international policies and standards. First of all, we look at the key challenges in the health sector. We have very poor performance in the sector, including insufficient financing, inadequate and inequitable access, weak supply chain management, limited human resource capacities, and insufficient coordination, cohesion, and accountability. So it is not just a question that we are not budgeting enough. Even the little that is budgeted is not properly managed. If you look at page 6, you see the key health indicators in Nigeria. Average life expectancy of 52 years, which is lower than that of Ghana and South Africa. Infectious diseases remain high, and we rank poorly on incidence of tuberculosis, 128 out of 108 countries. Prevalence of HIV, 123 out of 138 countries. Under 5 and child maternal mortality and morbidity, you see that we are below the sub-Saharan African average. Now, if you look at the sectoral goals, targets, and strategies, the key document there we are looking at is the recently unveiled Economic Recovery and Growth Plan, which talks about improving the availability, accessibility, affordability, and quality of health services, expand health coverage to all local governments, provide sustainable financing for the health sector, and reduce infant and maternal mortality rates. You look at those targets, it's there on table 2, which runs from page 7 up to page 8. Revitalize the primary healthcare system, roll out the universal health coverage under national health insurance, strengthen delivery beyond the primary healthcare system, partner with the private sector to construct model mega health centers, build the capacity of healthcare personnel to improve service delivery. So all these are carefully articulated. You look at the National Health Policy 2016, it has a vision, mission, and policy goal. The mission is to provide stakeholders in health with a comprehensive framework for harnessing all resources for health development towards the achievement of universal health coverage as encapsulated in the National Health Act 2014 and in tandem with the Sustainable Development Goals. While overall policy is to strengthen Nigeria's health system, particularly the primary healthcare subsystem, to deliver effective, efficient, equitable, accessible, affordable, acceptable, and comprehensive healthcare service to all Nigerians. So you can see national targets on key disease interventions,